Thanks so much for joining us, whether you're watching on TV or online. I'm Farah Nasser. Prime Minister Justin Trudeau is set to provide his daily COVID-19 address from outside Rideau Cottage any minute now. You're looking at this shot. We haven't received the 2-minute warning, but as soon as he does speak, of course, we'll go there live. While we wait, let's take a look at where the numbers stand in Canada. Almost 1 million Canadians have now been tested for COVID-19. Nearly 64,000 of those tests have been positive, and more than 4,000 Canadians have died due to complications from COVID-19. Now, almost all of the new infections and deaths are in two provinces, Ontario and Quebec. Take a look. Ontario reporting 399 new cases today alone. Most other provinces and territories are reporting single-digit increases or no new cases at all. Saskatchewan reporting 25 new cases, 70 in Alberta, and there were 23 new positive tests reported Wednesday in British Columbia. And as we do every day, our global news correspondents are standing by with the very latest on the pandemic. You see Reggie Cicchini there. He joins us from Washington, and he's going to have the latest on the economy south of the border, states reopening, as you know, despite meeting White House, or not, I should say, meeting White House guidelines. They're still reopening. And Abigail Beeman joins us from Ottawa as she has more on the situation at home. And Abigail, let's begin with you while we wait for the Prime Minister. Again, we don't have that 2-minute warning, but do you have an idea? Oh, we just got the warning. But tell us in 2 minutes, what is the Prime Minister expected to speak about?
Well, a couple of topics. We are expecting him to address the latest on the help coming from the Canadian Armed Forces. And we just heard a few minutes ago from the Defence Minister, who said that as of now, there are more than 1,000 Canadian Armed Forces members who are helping out mainly in long-term care homes in Ontario and Quebec. There are also Canadian Rangers who are providing some assistance in smaller numbers in Quebec as well as in northern Saskatchewan. We're expecting the Prime Minister to address that. And also talk about
Abigail, I'm just going to interrupt you. He's speaking live. Thanks so much.
Words about the terrible helicopter crash that claimed the lives of 6 armed forces members last week. Yesterday, I attended a ceremony in their honor. I was grateful to have an opportunity to pay my respects. I got to speak with mothers, fathers, and stepfathers, grandparents, friends, sons and daughters, fiancés, partners, and loved ones. All of them were heartbroken, but all of them were also immensely proud of the life of service chosen by their loved one, as are we all. We will never forget their service. They will live on in our hearts, and I know the thoughts of all Canadians are with the families and loved ones who are going through an incredibly difficult time. We stand with them, and we will continue to stand with them. As time and time again, members of the Canadian Armed Forces step up to help those in need, whether it be as a part of a NATO mission in Europe or in the wake of a natural disaster here in Canada. They're always there for us, eager to help, ready to serve, and this pandemic is no exception. When our government received requests for assistance from Ontario and Quebec, our men and women in uniform once again answered the call. In Ontario, 265 CAF members have now been deployed to 5 long-term care facilities. They're supporting our frontline workers, caring for our parents and grandparents, and bringing some comfort to their families. If you've lost a loved one in one of those facilities, or if you have a loved one that you haven't been able to visit for weeks, you're worried sick about what tomorrow will bring, and you hope that they're getting the care they deserve. Seeing our CAF members offer their help and talents during these uncertain times is a reassuring sight for many of these families. So I want to thank all of those who've been deployed and all the frontline workers who continue to work harder than ever to keep our seniors safe. À l'échelle du pays, environ 1,200 Rangers Canadiens.
In the country, some 1,200 Rangers have been deployed in order to stop the spread of the virus in several means, including 200 rangers in Nunavik and in the lower North Shore in Quebec. And throughout Quebec, we now have more than 370 members of the Canadian Forces in some 20 long-term care facilities with 350 additional members supporting them. We foresee that next week a total of some 1,350 military will have been in support of some 25 institutions. These long-term care residents are those that are the most hit by COVID-19, and the Canadian Forces members are there to help. They're now taking care of our parents, our grandparents. They're supporting the attendants, the nurses, and all the frontline healthcare workers that are putting in long hours and have been for weeks under conditions that are becoming more and more difficult. So let's take a moment to thank all of our military are helping out at this point in time. I would also like to recognize the incredible work that our first-line workers have been doing since the beginning of the crisis, whether it be in long-term care facilities or elsewhere. You are a source of great motivation for all of us. You take care of our parents. You take care of our sick. You take care of all of us. You are leading the battle against COVID-19 since the very beginning of the crisis, and you deserve more than just a thank you. You deserve to be paid properly for the work that you're doing. So today, I am announcing a deal that we have reached with all provinces and territories in order to improve the salaries of these essential workers. We are finalizing the details with the last few provinces, but I'd like to point out that it was a joint effort. All premiers agree that we must support our frontline essential workers, and I'd like to thank them for having discussed this issue with me on a team approach. We count on that more than ever, and we will be there for everybody. It's the governments of province and territories that will decide the exact workers who will be receiving a boost in their salary, a premium. But here is what you have to think about. If you're risking your health in order to help us through this crisis and you're being paid at minimum wage, you deserve more.
Today I can announce that we have an agreement with all the provinces and territories to provide a wage top-up for essential workers, for Canadians who are being called to go to work every day, for Canadians who are providing us with essential services so we can continue to keep our families safe and healthy. Right now, we're finalizing the details with the last provinces, and I want to underscore that this has been a truly collaborative effort. Premiers from across the country all agree that we need to support our essential workers. And I thank the premiers for the continued Team Canada approach. We're relying on these workers now more than ever, and we will be there to support them. It will be up to each province and territory to determine who exactly qualifies for this wage increase, but the bottom line is this. If you're risking your health to keep this country moving and you're making minimum wage, you deserve a raise. I want to close by noting that today, Buddhists in Canada and around the world will mark Vesak, their most important festival. While this year's celebrations will be a bit different, the Buddha's message of peace, selfless service, and compassion to those in need is more important than ever. I want to wish a happy and peaceful Vesak to all those celebrating. I'm now happy to take people's questions.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone aujourd'hui. Opérateur, c'est à vous.
Start going, operator. First question today, Catherine Lévesque, Canadian Press. Over to you. Good morning, Mr. Trudeau. How can we explain that it took so long to come to an agreement with the provinces about these bonuses or top-ups for our guardian angels? And what have you come to terms about a certain amount, like $4 or $5 an hour or something? Answer. Once again, we know that provinces are facing different situations from one end of the country to the other with regard to COVID-19, and they have different approaches about their essential workers. So On our part, at the federal level, we wanted to help the provinces with the 75% of financing that they will want to offer to support their essential workers. At the federal government level, we're talking about some $4 billion as an investment in essential workers throughout the country, but it will be the provinces themselves that will decide specifically how, when and where, and to whom these funds will be offered. Follow-up question, Catherine? Yes, please. So I understand that it's not a uniform amount of a bonus for everybody throughout the country. Now, your chief scientist, Madame Némère, criticized the absence of a clear plan in Quebec as they are talking deconfinement. So did Quebec drop the ball on this? We recognize that we have to do much more testing in the months to come if we want to reopen the economy and keep Canadians safe. All provinces and territory have to do more. We've seen improvements, important improvements, even these last few days, including in Quebec. And at the federal level, we will continue to work with all provinces in order to improve testing. We know we need to do more, and we shall continue to be there to help provinces and territories do more.
Next question.
Thank you. Next question, Ryan Phillippe, National Post. Line open.
Yeah, good morning, Prime Minister. I'm wondering if you can give us an idea of what this program will cost the federal government overall. And given that you seem to be leaving this up to the provinces, like, what sort of guidelines have you given them about how to spend those federal dollars?
We see across the country people working on the front lines in essential services, in our seniors care systems, in our long-term care, in our healthcare systems, and elsewhere, who are making very low wages while doing extraordinarily important work. That's why we announced a number of days ago that we wanted to move forward with a top-up to be delivered by the provinces to those workers who needed that extra support. We put forward around $4 billion from the federal government to be matched, 3/4 from the federal government, 1/4 from the provincial government, on helping those workers right across the country. But because of the variance across the country, both of the COVID-19 situation and of a delivery of essential services, including healthcare, we felt that it was best that provinces move forward in choosing exactly how they can best help the workers who are doing such important work right across the country. This is another great example of how the federal government and the provinces and territories have been able to come together, collaborate, work together to support Canadians through this extremely difficult time.
On follow-up, Ryan?
Yeah, what about non-medical workers, I guess, people who work in grocery stores and delivery drivers? Some of those workers, like you say, are working minimum wage. Are they going to be eligible for this top-up?
As I said, those are determinations to be made by the provinces. I know a number of provinces had already put out lists of workers that they considered to be essential, and many of them are drawing from those lists in terms of who gets the top-up. We have confidence that the provinces will determine exactly how best to help Canadians in this time. The federal government wanted to be there, and we know that offering this money to workers right across the country will make a big difference, and we trust the provinces to make sure that people who need it gets this help.
Thank you. Opérateur, prochaine question.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Oui, bonjour, M. Trudeau. Concernant cette annonce sur la bonification du salaire, c'était attendu depuis longtemps, puis aujourd'hui, vous fournissez aucun chiffre.
About this increase, we've been expecting it for some time, but you don't provide any numbers with it. You do talk about the cost of the federal contribution, but for the Quebec, there'll be some compensation already provided because they already have their own program for topping up the salary. We signed agreements, or we are currently signing agreements with all the provinces and territories. We know that it's something that the federal government and the provinces can and should work together. From the federal viewpoint, we're talking about an investment of $4 billion in these essential workers throughout the country, and we wish to support the three-quarters of the programs that provinces themselves will set up. And so with Quebec, we concluded an agreement, and I know that it was well received there, and that the federal government is there to help Quebec out in the work they're doing with these workers. Follow-up question, Emilie? Yes. About the military and long-term care facilities, I know it was a problem. The fact that military personnel move from one facility to another. So from the point of view of the military, can you ensure that once they're assigned to one place that they stay there? I have no specific information to share on that point, but I do know that the military take all necessary precautions to ensure both their own security and that of the people they're caring for. That is why the military have been assigned to these long-term care facilities, to specific ones, because we want to ensure that we're helping and not putting the patients at the risk of a greater spread. Thank you, operator. Last question.
Thank you. Merci. Next question. Please invite the Canadian press.
Good morning, Prime Minister. Earlier this week, the Chinese embassy tweeted that the N95 masks, which were rejected by Canada last month, were the result of a contractual issue that has now been resolved. Your Deputy Prime Minister and Health Minister said that they would look into it, but have yet to respond to explain what happened. Was there a contract problem that led to 1 million masks from China being rejected? What was the issue, and has it been resolved?
We have, over the past weeks, received millions upon millions of items of PPE from around the world, including from China. Over the course of this time, there have been a small number that have been not to the levels that Canadians expected. We are continuing to follow up and work on it to make sure that the equipment that we deliver to our frontline workers, to our healthcare workers across this country, is at Canadian standards. We will be receiving flights of PPE from China and other places almost daily over the coming weeks. We know that we are needing to ensure enough high-quality equipment for Canadians right across the country, and we're continuing to do just that.
It's been some weeks now that we have received some 20 flights full of medical equipment from China, mainly from China, but also from elsewhere. We know that with the millions of pieces of equipment received, there was a small number that weren't up to Canadian expectations in order to provide them to our frontline workers. So we've put them aside, and we're working to avoid receiving other that aren't up to our standards. But we are confident that since we will be receiving full flights of equipment daily for the time to come, some time to come, that we will have quality equipment provided to Canadians. Follow-up question?
Thank you. People working in grocery stores and on farms and in long-term care facilities have often come from marginalized populations, and now they're considered essential workers. Are we placing too high a burden on marginalized people in this pandemic?
I think one of the things that we're seeing through this pandemic is that there are people who are tremendously economically vulnerable and vulnerable in other ways in our society who are extremely important to the functioning of our society. As we've made it through this pandemic so far, we've been focusing on supporting these most vulnerable people, and this top-up for essential workers delivered by the provinces is another piece of support for people who need it in order to get through this time as best we can as a country. We know, however, that once we get through this in the months and years to come, we're also going to have reflections about how we manage and how we maintain our long-term care facilities, how we support essential workers who are very low paid, how we move forward as a society to make sure that our vulnerable are properly taken care of and properly rewarded for the important work they do. Je pense que nous allons tous réfléchir.
I think that we'll all be giving thought over the months and years to come to ensure that people who do essential work are properly paid and that they aren't economically vulnerable. And these thoughts are for the mid and long term. But in the short term, we want to support everybody who needs assistance with the various measures that we've put forward. For example, the emergency benefit, and also with the benefit being out today, a top-up for essential workers that will be delivered by provinces that we've agreed to. We have to get through these difficult times, but obviously we'll have a lot of thinking to do as a society about how we can improve Canada for all.
Good morning, Prime Minister. Kevin Gallagher with CTV News. Cargill, meatpacking in High River, Alberta, the workers have gone back. Many are still very concerned about the safety of their work conditions, but also outside of the factory in their communities. Many are experiencing racism and discrimination because they work at the plant. Many of them, of course, are new Canadians. You have said that worker safety really falls under provincial jurisdiction, but at what point does the federal government have to step in to ensure worker safety at Cargill and other food processing facilities across the country?
One of the things that this crisis has shown us is various points of vulnerability, both in our supply chains, but also in terms of people who work in jobs that we find extremely important right across the country for feeding Canadians, for allowing our economy to run. There are obviously going to be many reflections we're going to have as a society in the coming months and years on how we make sure that the country is fair and the country is supportive and protecting everyone in the important work that they do. In the meantime, we will continue to work with the provinces on assuring both continued flow of food supply chains, but also ensuring that there is proper support for the people who work in these industries and in this processing and in agriculture. That was part of what our announcement yesterday, which was a first and initial installment, our first investment in supporting agricultural workers and producers to be able to be safe while they do such important work for Canadians.
We are talking about like the largest outbreak in North America here. So how do you evaluate the provincial regulators here? You know, has the province done enough, in your view, to keep those workers safe?
I think there are a lot of questions being asked of how various provinces have handled different aspects of this pandemic. I will be talking with the premiers tonight to offer again in so many different ways how the federal government can help. What we just announced today as a top-up for essential workers is a great example of the federal government and the provincial governments working together on protecting Canadians. Obviously, there are always things to learn, always things that we need to do better. And as the provinces look to step up and do more and do differently and do better, the federal government will be there to support them.
Bonjour, M. Trudeau. Mathieu Goyer de Radio-Canada. Je reviens sur
Mathieu Goyer, Radio-Canada. I'd like to come back on this top-up that isn't this an admission that the CERB was too generous and it kept essential workers at home? A disincentive answer. Will be receiving the statistics on the jobs lost in April tomorrow. Millions of Canadians lost their job, lost their paycheck, and would not otherwise have had the capability of buying groceries, paying their rent. So that's why we put forward the CERB, and it was there for millions of Canadians to support them during these times where we must remain confined at home. It was an essential measure, and it shows how Canadians are there to support each other in difficult times. Simultaneously, we also recognize that there are workers undertaking essential work for society and that deserve improvement in their salary level, and that is why we're so happy to have managed to work cooperatively with provinces to provide assistance to these workers. I'd like to come back to tests. Madame le Maire raised some concerns, but is it not now the time to have a pan-Canadian strategy, a uniform strategy for testing to ensure that all provinces have the right tools to follow the evolution of the pandemic as they reopen their economies? Answer: provinces face very different situations from one end of the country to the other. Therefore, a federal program that would be applied everywhere would not be the right solution. We are there to support provinces, to support them with resources, material, to help them develop better plans to have more testing in order to support the reopening of the economy while yet keeping Canadians safe and sound. And we shall continue to work always to bring out improvement in all provinces, and we were there to support them, working with them in this unprecedented situation we are facing.
GCBC, as a lot of governments are looking towards recovery from this, the economic recovery here in Canada, how will you be able to help the Canadian economy get back on its feet from this, reduce spending, and yet also respect some of the promises you made in the election, some big-ticket items like pharmacare and infrastructure spending?
Obviously, this situation has become the new priority that we have to deal with. It is an economic impact, the likes of which hasn't been seen in over 70 years on Canadians from coast to coast to coast, on families, on sectors, on businesses. And the measures we're put forward that are historic and without precedent in terms of supporting families and supporting workers and supporting communities and supporting small businesses. These are the things that are going to help us get through. And our priority right now is helping people hold on while we have to stay isolated because of COVID-19, and then start restarting carefully the economy in a gradual and progressive way with the right measures in place. Once we get through this, there will be plenty of time to talk about what the longer term looks like, what the future of Canada looks like, what is needed for various sectors, for various Canadians. We've seen a whole bunch of new needs popped up that we had not paid much attention to over the past years, like the plight of most vulnerable workers. We had, as a government, invested massively in reducing poverty over the past 5 years. We've seen over 1 million people lifted out of poverty, but there's obviously much more to do, and we're going to continue to focus on that. I think there is going to be time to talk about long-term plans as we get through this. Right now, our focus is on getting Canadians through this.
Right, but other governments are also focused on recovery and what they will do as part of that recovery. The UK, for example, its climate advisors are saying that all recovery will have a green focus. They have a net zero by 2050 commitment, just as your government does. So how will the recovery take into account your climate change promises in the last election?
I think one of the things that we're very much thinking about is how do we build back better? How do we look at what this pandemic has challenged us with, what it has highlighted around needs or gaps in Canada, and how do we look to rebuild and recover in a way that advances us in the right direction. Obviously, less pollution, greener outcomes are going to be a part of it. More digital, more connected is going to be a part of it. Better supports for vulnerable Canadians and more equality across this country needs to be part of it as well. These are principles that we're looking at right now and reflecting on how we go forward, and we're going to continue to.
Prime Minister Janet Silver, Global News. Yesterday, Green Party parliamentary leader Elizabeth May said the oil sector in Canada is basically dead. And the Bloc leader went on to say putting more money into that business is a very bad idea. I'm just wondering if you would share this assessment, and will your government give more money into this industry, given the opposition and given how low oil prices are and it's expected to continue for the unseeable future?
I don't share that assessment. I know that if we are to move forward in transforming our economy towards lower emissions and cleaner processes, workers and innovators in Alberta and across the country in the energy sector are going to be an essential part of that transformation, as we move forward towards a different energy mix, as we move forward to lower fossil fuel emissions, lower greenhouse gas emissions, we need the innovation, the hard work, and the vision and the creativity of people working right now in the energy sector. We need to support Albertans and other people working in the energy sector through this incredible difficult time as families, as workers, as communities. Not just because that's what we do as Canadians, but because we need their capacity to innovate and figure out how we're going to move forward towards our greater, greener goals. We can't do it without them, and that's why we're going to keep supporting them in the right ways. Okay. Je suis pas d'accord.
No, I don't agree with that assessment. We know that the only way that will allow us to move forward as a country is acting together with the energy sector as a partner in order to create better long-term solutions, to reduce emissions, and to innovate in the creation of new technologies. And for that, we need innovative minds, people willing to work, and that we can find in the energy sector. We can't reach our targets unless we appeal to our partners in the energy sector who will work together with us to find these solutions and thus transform our energy sector. We need these families, these workers, these communities in Alberta and elsewhere to be part of the solution, and to that end we have to support them. We will support them not only because that's what we do as Canadians, being there for each other, but we'll also support them because they are essential allies in the transformation of our economy towards a better future for all of us.
You indicated that you would look at other nations, for example, France and Australia, and what they are doing when it comes to tech giants like Google and Facebook being forced to share ad revenue with Canadian news content providers. Given how many news content providers are struggling, especially in small towns, and in some cases closing, and how vital those are to those small towns, you said you would address the matter. I'm just wondering, are you prepared to do so now, especially at such a vital time for Truth and News?
It is extremely important that we support our news sector because Canadians need the information to keep them safe, to plan for their futures, to lean on each other. We need the media now during a crisis more than we ever have. And that's why, as a government that has put forward significant measures to support news media, we're going to continue to work to do just that. I can assure you that Minister Guilbeault is working very hard and very closely with allies around the world to see what they're doing and with the sector here in Canada to ensure that Canadians get top quality information, that decision makers and politicians continue to be held to account, and that we continue to make decisions based on facts and a shared understanding of the reality we're facing. The work that the media does is essential. We will continue to support it. Okay. Les médias et les réseaux d'information sont plus importants.
Medias and information networks are more important now than ever. We know that having concrete and true information available during this pandemic is important for citizens so that they can take informed decisions. We have to ensure accountability of our decision makers throughout the country. We have to ensure that Canadians are properly informed about what's going on in the country and throughout the world, and that is why we will always support our information networks and the media. We, as a government, have already invested to help our media in these difficult times, and we shall continue to do so. Minister Guilbeault is working with the media and our international partners to see what they're doing, because we recognize that it will always be a priority for us in Canada to ensure that we have a solid information sector. Thank you very much, and this ends the press conference for today. Thank you, everybody.
Prime Minister Justin Trudeau speaking outside Rideau Cottage in Ottawa, and you heard the theme of the conversation today had to do with the wage top-up, an agreement between the provinces, a Team Canada approach, that's what the Prime Minister is calling it, with the provinces in terms of wage top-up for essential workers. I want to bring back in our correspondents. Abigail Beeman is in Ottawa for us. Reggie Cecchini is in Washington. Now, we're also going to be hearing about job numbers out of Canada tomorrow. Very bleak job numbers expected out of Canada, but we're going to talk about the economy south of the border, because in terms of numbers, it's even worse there. I know, Reggie, you also have some information about someone inside the White House testing positive for coronavirus. So we're going to get to that in just a moment. But Abigail, let's first start off with this conversation on the wage top-up. There was a couple numbers being floated around. There was $3 billion and $4 billion. So maybe first walk us through how this is going to work money-wise and who's going to get what.
Well, we don't really have any answers to any of those questions. It was an extremely vague announcement. Like you say, you heard the Prime Minister say $4 billion. Then a release came out as he was speaking from the Prime Minister's office talking about up to $3 billion from the feds for wage top-ups directed at people making minimum wage. But it's really up to the provinces in terms of who gets this money, what types of workers, how it will be doled out. And the Prime Minister sort of suggested that he didn't want to give more details because some of the provinces were still finalizing those details, but he said that everybody came to it together. So I have a question in to the Prime Minister's office right now, waiting on some clarification as to whether it's $3 billion or $4 billion. But the Prime Minister also said that 75% would come from the feds and then the provinces would contribute the other 25%. So I suspect that's where that difference is, but still waiting on some clarification to figure that out. So the Prime Minister repeated over and over again that it's really up to the provinces here to make the best use of this money and to decide based on, each province's individual need where those funds should go.
Okay, Abigail. The other big theme out of this was also what makes a frontline worker. So we're going to talk about that in a sec, Abigail. So I'll keep you on standby if you don't mind. But I want to bring in Reggie Cecchini with this developing news. Reggie, Reggie's in Washington for us. Who inside the White House do we know is tested positive now for coronavirus?
Hi, Farah. We're getting a note from the White House that it is a personal valet to the president. The valets are kind of an elite military unit that work very closely alongside the president and the president's family members. And the note from the White House essentially says, we were recently notified that a member of the United States military who works on the campus has tested positive for the coronavirus. The president and the vice president have since tested negative for the virus, and they remain in great health. But this does raise questions and concerns, given that we know how long it takes for this virus to incubate inside the body, and that you can test negative one day but potentially still have that virus inside of you. It's worth noting the president was just on a trip in Arizona earlier this week, touring a mask at the Honeywell facility where he wasn't wearing a mask. There were no people around him wearing a face covering either. So this is kind of raising questions and concerns inside the White House that the president's health could potentially be put at risk here. But it's also raising questions given the fact that the president and vice president often work very closely with each other. What would be to happen if both of them were to fall ill? These are things that we're following right now.
Yeah, I imagine. Speaking of Arizona and other states, there are several that are reopening despite failing to meet guidelines set out by the White House. Talk us through that and where.
Well, so the CDC and the White House had put these guidelines out a month ago that had a number of different criteria that you had to meet in each of these three phases just to be able to reopen the very beginnings of your economies. No states have even come close to step one for phase one. That was the gated criteria that showed a 14-day downward trend in reported cases and an ability for hospitals to be treating patients at pre-pandemic levels. At least 10 states haven't come close to that right now, yet we have 43 states by the end of this coming weekend that will either be partially opened or fully reopened and have relaxed most of their stay-at-home or safer-at-home orders. And this is a growing health concern now, and a growing concern for health experts and for epidemiologists who say that given the number of daily confirmed cases across the country right now, which average around 25,000, this allows for an increased possibility for this virus to continue to spread as we see people cramming onto beaches and packing small businesses around around the country. The average death toll right now in the U.S. Sits between 2,000 and 2,500, and models just earlier this week had predicted that we could be reaching a death toll of 3,000 per day by June, and that's where the fear for these health experts come, that if more people start to gather around each other as these states reopen, we run the risk of seeing these models actually come true far earlier than they were expected to.
Especially if the testing isn't there, right? Especially if the testing, the contact tracing, if that's all not there as it should be, that's the big concern. Now, we've seen President Trump shift his task force, so to speak, from the coronavirus and from the health angle to the economic angle, and that's why we're seeing states reopen. And there are new job numbers today just to show us what the economy is like right now in the United States. What's the latest, Reggie?
Yeah, so the weekly jobs report out today shows that 3.2 million, or just about 3.2 million Americans filed for first-time unemployment claims last week. Tomorrow's jobs report for April will show roughly 20 million Americans out of work for the month. But since March now, we're looking at roughly 33 or 34 million Americans who have lost their job because of the COVID-19 outbreak around the U.S. That works out to about 90% of the population of Canada without a job right now. And this is a part of that real push and that broad shift in messaging when it comes to the White House and the changing roster of their task force in order to focus on the economy, because the president can't ride a message of medical advice when there's a consistent and persistent push that reopening economies is simply going to do more harm. The president needs to be able to say that he's taking any opportunity he can to build things up. There is a growing push, a growing surge of Americans who have been protesting outside of state capitals, trying to get their governors to reopen economies. That's why we're seeing this increased push within the Trump administration. But the president as well simply says that he doesn't want to see the country locked down for years. That was never going to be a possibility down here. But epidemiologists and health experts, including Dr. Birx and Dr. Fauci, have been saying for weeks now, if you go too quickly, there is a risk that those economies will have to shut down a second time again, throwing potentially millions of more people out of work. But also, that's going to cost states that are already losing billions of dollars right now in lost income and lost revenue with the amount of businesses that are closed. And we're hearing that state budgets are so tight right now that there are going to be hundreds of millions of dollars cut to education within the next couple of months before kids even go back to school, if kids are able to go back to school. This is a virus that still has a lot of confusion left to it, and that simply is being kind of expanded on right now by the fact that the president is pushing for an economic recovery, despite the fact that there is no health recovery yet.
Reggie, let's focus on one specific state, and that's New York City. There's a report that links outbreaks across the U.S. To not a state, to a city, to New York City.
Yeah, so geneticists have seen that New York City really is a cause of the spread around the country. There were outbreaks across Louisiana and Florida and Georgia, along with Arizona and some states along the West Coast, where they've been able to trace the origins of the virus or the outbreaks in those states back to New York City. And that's simply because at the very beginning of this outbreak, state leaders were simply too slow to act to be able to stop the spread. So given the fact that New York was such a hotspot on this, with the virus being able to be traced back to Europe and eventually traced back to China, they say that because of that slow action, the virus spread significantly faster than it would have if there were measures in place. Now, that's not to say that Washington State didn't also play a role in this. That initial outbreak in Seattle did get traced to outbreaks in about a half a dozen other states, and we know that Washington's original outbreak kind of was on a skip-stop journey from Wuhan province right into America. But it is worth noting here that geneticists and health experts say even if New York had locked itself down earlier, the virus simply would have continued to spread around the United States, but possibly at a lower level. It also speaks to what epidemiologists have been saying for weeks now, is that these viruses live in silent hotspots around the country. So as we see numbers in New York continue to decline, we're seeing the rest of the country continue to push an increase in their case numbers. And that likely could be the story now for weeks, if not months to come.
And, you know, with so many crises, we see these crises that it's, you know, the vulnerable populations that are being the hardest hit. We're also seeing that across the United States. So that's something we're watching. Thanks for that, Reggie. Reggie Cicchini reporting. I want to bring in Abigail Beeman now, because I believe Abigail got some clarification on that figure that the Prime Minister mentioned. Do we have Abigail?
Yes, yeah, and we have a clarification as well. So we were hearing about that $4 billion number being thrown around, as well as $3 billion, and clarification from the Prime Minister's office that it's up to $3 billion being offered by Ottawa. The remaining $1 billion will be coming from the province. Of course, 3 + 1 is 4, but we needed that clarification as to whether that's how the breakdown was working, since the Prime Minister had referenced $4 billion. So again, this is money that is going to essential frontline workers for a wage top-up designed for people making minimum wage. But really, who gets this top-up depends on each province. And we understand from the Prime Minister's comments that not every province has finalized their decisions about exactly who will be getting that money. But so many people, could qualify as an essential frontline worker. So each province will have to determine whether we're just talking about people who work in long-term care facilities, for example, or could it expand as wide as to grocery store workers as well. Those are questions people will be asking premiers today in different provinces.
Yeah, and the Prime Minister was asked that as well, because there's, again, a lot of people who are making minimum wage. We know that here in Ontario, I can tell you that the taxi industry has faced, deaths because of this. Also, one of the first cases was a custodian at a school. So these are people who are on the front lines, but they don't necessarily work in the medical field. And the Prime Minister was asked that today, but he's kind of put it over to the provinces in terms of how they decide, Abigail, who gets what.
Right, and that is extremely consistent with the Prime Minister's messaging throughout this pandemic. He has always been very clear that things that are up to the provinces should be left up to the provinces, and he has this entire time spoken about the great level of collaboration that has come from all the provinces. He has a call scheduled late this afternoon or early evening with the premiers once again. These calls have been happening about once a week, and that's crucially important to have all the premiers on board. Obviously, not everybody will agree about everything, and obviously the situation differs province to province across this country. But that was, one of the biggest consideration when deciding not so far to put the Emergencies Act in place. That's because things had been working with the provinces being able to make their own decisions. So the Prime Minister again saying, and he's stated it on many different topics today, it's about a wage top-up, but that this is a provincial jurisdiction, like you hear in terms of healthcare. And another example I should mention that came up today is the Prime Minister was asked about the workers at Cargill. And, this is, again, provincial jurisdiction, but he was asked today, when will it be federal? When will it be time for the feds to step in and protect these workers who are sick and dying connected to the outbreak at the Cargill plant? That's something we heard over and over again from the NDP in the House yesterday, who are, of course, pushing for federal involvement here. And the Prime Minister didn't give a very clear answer on that front, on this specific question of Cargill. He did talk about how they're going to continue to work with provinces to make sure that these supports are in place. But just yet another example of the complicated system that is at play here when provinces are making their own decisions, and some things are working with the feds and others are under their own jurisdiction.
Yeah, and one thing some of the provincial premiers don't agree with the Prime Minister about is the CERB. I've heard some premiers say that it's an incentive for people not to work. We have the April job data coming out tomorrow. We know last month more than 1 million people were unemployed, and April could be even worse. But there's also industries, Abigail, that are asking for help. And I know that the energy sector is one of those industries, the airline sector as well. But let's focus on energy for a second, because we were expecting an announcement to come at some point. What did the Prime Minister say about oil today?
That was another important question because of the comments that were made yesterday outside the House by the Green Party's Elizabeth May and the leader of the Bloc Quebecois as well, who both made comments to the extent that oil is dead. The oil industry is dead. It's time to invest money in renewable energy instead of the oil industry. Our own Global News' Janet Silver asked the Prime Minister that question today for his thoughts on those comments, and he was very clear in one of his clearest answers in this news conference that he does not agree with the sentiments expressed yesterday by the Greens and the Bloc. He said it's very important that we support people in Alberta and elsewhere affected by the downturn in the oil industry, that they continue to be supported. He was very clear that he does not agree with those comments. We can expect some more reaction and fallout from the ripples that were caused by those comments yesterday.
Abigail, the Prime Minister also started talking about the Canadian Armed Forces, and we heard Harjit Sajjan this morning speak as well. Where do we know, where is the government in terms of the investigation into that tragedy, that helicopter crash off the coast of Greece now more than a week ago?
That's right, and we know that the Prime Minister attended, obviously, the repatriation ceremony yesterday in Trenton, Ontario. But his comments today were more focused on the help that is coming from the Canadian Armed Forces, largely in long-term care facilities. We know that there are more than 1,000 members who are helping in various capacities in long-term care facilities in Quebec and in Ontario, and the number of facilities getting help is expected to increase in the next couple of weeks. The Prime Minister also said that there were more than 1,200 Canadian Rangers who are helping in a variety of places across this country. We know that some are in Quebec. Quebec was the first province to ask for help there. We know that there are some in northern Saskatchewan as well. So his comments today around the Canadian Armed Forces help were largely focused on the help being provided in those places.
Okay, Abigail Beeman, thanks so much. That's Abigail Beeman in Ottawa. I want to head over to British Columbia now, where cases of COVID-19 have been on a downward trend, and that province now moving ahead, you might have heard, with plans to start lifting some of the restrictions. We have Richard Zussman. He is standing by in the provincial capital in Victoria. Richard, the news yesterday must have come as welcome news to a lot of British Columbians, hearing school is going to open at some point this month, and people might even be able to get a haircut. Tell us the latest.
Yeah, so there's a lot to unfold here. On the school side of things, it will be optional school for British Columbians starting in June. It's being described by Premier John Horgan as a dry run for the September school year, where things then will look different as well. But it's all part of this phased-in approach. British Columbia has been leading the way in terms of the big provinces in this country, in terms of the decrease in cases and the decrease of people in intensive care units. Just a few days ago, there were only 8 new cases in British Columbia. Yesterday, it was a little bit more than 20. So there's going to be this very gradual reopening of BC's economy. It will start the May long weekend, where people will be able to widen social circles, but the province wants to take this slow. So it will mean that each person here can choose 1 or 2 additional people to bring into their bubbles, as they're being described, and create that socialization. In terms of industry, the province is setting up a way to approve different industries opening up on a case-to-case basis. So restaurants will have to get plans approved in order to operate in restaurant dining. That will obviously include physical distancing rules, as well as protection equipment for staff. That could be plastic shields, it could be masks, in order to ensure that there's no spread between staff and patrons and staff. It's all part of what's being described as a very, very gradual reopening of BC's economy.
Let me ask you, though, because the biggest things about the reopening, testing and contact tracing. So where does BC stand in those 2 areas?
Yeah, the testing part has been changing over time. The testing strategy has evolved, and right now British Columbia is at the point where anyone who believes they need a test can get a test. In terms of the contact tracing, it's something that the province is looking at closely. The plans are not as clear, though, as what we're seeing in places like Ontario, where there's been far more details around what sort of tools will be used for contact tracing. Here in British Columbia, the strategy is very much evolving around what sort of apps are potentially going to be used, what sort of technology the province is going to be used. Dr. Bonnie Henry, the Chief Medical Health Officer here in the province, says it's still something that's being looked at. But at this point, there's a lot of confidence that the caseload is under control. The outbreaks are under control. Again, that's very different than what we're seeing in Ontario and Quebec. The case numbers have been consistently going down, and when we hear a lot about this flattening and bending of the curve, Dr. Bonnie Henry says BC has flattened the curve. We are at that point. And so testing is important, but it's more about controlling the spread, which BC believes is under control at this point. But again, it's not a return to normal. It's going to be a very gradual reopening, but there are some steps being taken. Dr. Henry described it this week. We are now at the end of our beginning, and we move on to the next phase.
end of the beginning. That's an interesting way to put it. Richard, I wanted to just focus a bit more on the double bubble idea, because I know New Brunswick's doing that. A lot of provinces are looking at that right now. We have Mother's Day just around the corner, the May long weekend. What exactly is that going to look like in BC, and how soon could we see it there?
Yeah, so it could be May long weekend. So Mother's Day, they do not want people to expand the bubbles quite yet. And so those that are in your tight social circle that people have been keeping across the country, that will maintain here in British Columbia for Mother's Day. But for the next weekend, they are speaking about potentially widening that circle so you can have maybe a play date for your kids, potentially see the grandparents or extended family, but no wider than that. No large gatherings. If there are small gatherings, the advice is to keep them outdoors. And so it's really to think, as you mentioned, that doubling the bubble. Think about expanding your social circle by double, but no more than that. And again, all the other requirements should happen. Physical distancing when possible. It's all sort of part of this gradual reopening. And the dates were a little bit unclear from the Premier, but the target is around that May long weekend. But again, May long weekend for so many in this country is about going to cottages and cabins, enjoying the outdoors, enjoying the beauty of our country. And the reminder here is don't do that yet. You know, for Albertans who may be listening that want to come to British Columbia for the May long weekend, not yet. The plan for all that, for sort of an expansion of travel, won't be until the summer, if not later than that. So that's the advice is, you know, stay together, expand your circle, but do not travel, do not go to your cabins yet. We can't handle that yet because many of these cottages and cabins are in more remote areas where they don't have as much access to the healthcare system.
And I think every province is struggling in that sense with the May long weekend coming, wondering, you know, how that's going to affect the numbers that we see. I'm wondering, Richard, do you have any insight on how things are going to look? I know south of the border, some of the streets have been, for example, converted into pedestrian streets. In Ontario, they're planning to do that as well. In Toronto, in a big city like Toronto, some of the streets going to be converted for pedestrian only. And then schools and hair salons. Do you have any concrete insight on how things will look there, since BC is doing so well? It's kind of a possible future for everyone else.
Yeah. So schools, we do have a little bit of clarity on that, and this could be applied to other jurisdictions in the country. So we know that desks will be spaced out 6 feet apart. We also now know from what we heard yesterday that there will be a health screening done for every staff and student. And that may sound alarming, but what it's going to be is the simple question every morning: how are you feeling? And if the answer is I'm not feeling well, then there needs to be a solution where that student or that staff member goes home. It won't require a temperature check or anything to that magnitude or a COVID-19 test, but it will be daily, part of the routine. How are you feeling? And then also around schools, they're looking at still some possibilities around staggered starts for kids. So potentially some students could go in the morning, others in the afternoon, so the class sizes are smaller, and they could also alternate days. Those are still things. The big school plan won't be announced in BC for a few more weeks. In terms of restaurants and street closures, that's up to municipalities, and municipalities are looking.
Oh, I think we're having a problem with Richard's mic. If we can get that sorted out, we'll go back to him. Just to give you a quick recap of what the Prime Minister spoke about, and then if we have time, we might go back to Abigail as well. He confirmed the federal government has reached a deal with all provinces. That's for a wage top-up for essential workers. So they had a phone call. They're going to have another phone call this afternoon to specifically iron out the details, because there's still some agreements with some provinces that have not been finalized. But we know this program could be worth up to $4 billion. Trudeau says the details of who deserves the wage top-up and how they will be how they will receive it will be determined by each province. So each of them will decide. But there were a lot of questions about who who really qualifies for this. There are a lot of essential workers who are not in the healthcare industry, who grocery store, cleaners, people who might be drivers, delivery drivers. So do they qualify for this as well? And the Prime Minister said that he trusts the provinces to sort it out. He called this a Team Canada approach, a collaborative approach. So he was trying to show that the provinces are working together in this way, especially when it comes to the wage top-up. But even in the medical field, there are questions about who gets it. Midwives in Ontario have been asking to be included on that list as they are not there. So a lot of questions in terms of who will be getting this wage top-up. But it is focused on people making minimum wage. That is the hope from the Prime Minister. Now, the Prime Minister also thanked the Canadian Armed Forces for their work in long-term care homes, saying there are 265 members in facilities in Ontario and more than 1,000 in Quebec. They had to get training on how to use PPEs. They also had to learn how to work in long-term care settings with our elderly, with some of our most vulnerable people. So that's happening right now in those two provinces that are struggling. And those two are clearly, if you look at the map on COVID-19 cases, those are the ones that have the new cases. Those two provinces are the ones that need the support. We also know new April jobs data coming out tomorrow. We know in March, 1 million people filed for unemployment or the CERB. And we know that that number could even be larger as we look to this month. So those job numbers coming out and the job numbers in the States coming out as well. We also just want to point out that we know that a valet of President Trump has now tested positive for COVID-19. Trump and the Vice President have tested negative. What you're looking at is you're looking at West Block, room 225, and we are going to be hearing from ministers as well as the Chief Medical Officer of Canada, Canada's top doctor, Theresa Tam, who will give us an update on that she does, as she does every day at noon. So stay tuned. You can find out all details on globalnews.ca. And tonight on Global National, I'm Farah Nasser.
So good afternoon and bonjour à toutes et à tous. So as usual, I'll start with the latest numbers on COVID-19 in Canada. There are now 63,895 confirmed cases, including 4,280 deaths. And over 28,000 cases, or 44%, have now recovered. Labs across Canada have tested over 1 million people for COVID-19 to date, with about 6% of these testing positive. In the past week, we've tested an average of over 25,000 people daily. As Mental Health Week continues, today's focus is on children and youth mental health. It's certainly not unexpected that kids will have lots of questions about COVID-19. Providing children and youth with information and extra nurturing can go a long way to offer reassurance and help to build up their resilience. Parents and caregivers can find lots of good tips to help kids and youth on websites such as the Kids Help Phone. Things like how to check in often, to communicate and share information, calm their fears, help them to practice online safety, and to engage in activities that can nurture mental and emotional health. As I said yesterday, talking things out can help to process our thoughts and lift the weight of our emotions. And this is as true for kids as it is for adults. And when you start the conversation and share your thoughts and feelings, it can help children and youth to open up and voice their own struggles. While kids may be missing their friends and other family members, maintaining virtual connections reminds us all that we are not alone. One thing that helps us all is the feeling that we are helping. A key way that children and youth help lift our spirits is through creativity and ingenuity. Their imagination is an inspiration. They have adorned windows with rainbow signs and messages for neighbors, friends, and essential workers. They've created virtual choirs, apps, and trackers. Reinforcing the positive energy of youth is a big step towards building resilience, not just for them, but for all of us. Thank you. Merci.
Bonjour. Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 63,875 confirmed cases, including over 4,000 deaths, and 28,000, or 44%, now recovered. Labs across Canada have tested over 1 million people for COVID-19 to date, and 6% of these tested positive. In the past week, we've tested, on average, over 25,000 people daily. As Mental Health Week continues, today's focus is on children and youth mental health. It is certainly not unexpected that kids will have lots of questions about COVID-19. Providing children and youth with information and extra nurturing can go a long way to offer reassurance and help to build up their resilience. Parents and caregivers can find lots of good tips to help kids and youth on websites such as the Kids Help Phone. Things like how to check in often, to communicate and share information, calm their fears, help them to practice online safety, and to engage in activities that can nurture mental and emotional health. As I said yesterday, talking things out can help to process our thoughts and lift the weight of our emotions. This is as true for kids as it is for adults. And when you start the conversation and share your own thoughts and feelings, it can help children and youth to open up and voice their own struggles. While kids may be missing their friends and other family members, maintaining virtual connections reminds us all that we are not alone. One thing that helps us all is the feeling that we are helping. A key way that children and youth help lift our spirits is through creativity and ingenuity. Their imagination is an inspiration, and they have adorned windows with rainbow signs and messages for neighbors, friends, and essential workers. They've created virtual choirs, apps, and trackers. Reinforcing the positive energy of youth is a big step towards building resilience, not just for them, but for all of us. Thank you.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics. Operator, over to you.
Thank you. Merci. Our first question, notre première question, nous vient de Michel Lamarche avec TVA Nouvelles. Please go ahead. Your line is now open.
Oui, bonjour, Dr. New.
Hello, Dr. New. I'd like to hear your comments on how well Canadians are following directives. Canadians have followed all the directives and advice and guidance since the beginning, as you keep repeating. But with new confinement directives, it's not clear in each of the provinces and from one province to the next, and sometimes from one region to the next. Do you feel we must be particularly vigilant with Canadians' adherence to these directives? Or do you fear that things will relax too much? Answer. Thank you for the question.
Dr. Tam and
I think so. Dr. Tam and I are constantly discussing current issues with our provincial and territorial counterparts. Certainly, in each province and territory, as you said, the relaxing of public health guidelines is being done with great prudence. We agree with the fundamental principles. As each province and territory moves ahead, of course, one must continue good hygiene practices, keeping our social distancing, physical distance from others, washing our hands, and all the other public health measures, which, as you say, we keep reinforcing and repeating. But the implementation of these measures in each province and territories depends somewhat on the epidemiology, even in each province. province. For example, in Montreal, the situation is far different from the situation in Lac-Saint-Jean. So we have to look at the epidemiology and what's going on the ground. Of course, the context of a large city will be quite different from what we see in a northern territory. But we're all on the same page, ultimately. And the plans that have been made public by various provinces and territories, it seems to me that they are still respecting the same fundamental principles. Now, the rate of change may be different from one province to another. In some provinces, they've opened schools and others no. So these aspects may be a bit different. As long as we're just keeping an eye on the curb and the epidemiology, because of course what took place in British Columbia is different from what's currently going on in Quebec. So we're keeping an eye and everyone's on the same page, and I think Canadians understand quite well what all the public health authorities, not just at the federal level, but in each province and territory, are quite well aligned, in fact. Thank you. Follow-up question? My next question has to do with a very specific example of people who can't see their way through these new directives. People aged between 60 and 69 in Quebec who could go back to work in schools, in daycare centers and school buses, but we don't really understand why these people still cannot see their own grandchildren. Doesn't that seem contradictory to you? So that people aged between 60 and 69, to whom we said their risk level was high, and yet that population is hearing contradictory directives now. Answer? Honestly, it's Dr. New here. Well, that is the true challenge. You have to strike the right balance between what is practical and feasible and what makes sense, while continuing to be guided by scientific data and evidence. We know, and everyone agrees, that seniors are at higher risk of more serious consequences should they become infected with COVID-19. But to accommodate public health measures and relaxing those, it's really up to each province and territory, who are basing their decisions on the same scientific data and evidence. So we count on that evidence to provide us with the best recommendations. And as I said, the context varies from one province and territory to another. The Quebec health authorities have made their decisions, and I am in no position to comment on those. I have a great relationship with Dr. Arruda. We speak often, and we agree on the fundamental principles of good public health policy. But as to the implementation, I respect what Dr. Arruda and the Premier of Quebec are doing. It's not an easy job developing such guidelines. This is something that's very detailed, and I really have no further comment on that. Thank you.
Thank you, Operator. Next question on the line.
Thank you. Merci. Our next question, notre prochaine question, is from Alex Bollingal with the Toronto Star. Please go ahead. À vous la parole.
Hi, thank you very much for taking my question. On testing, I understand that Canada now has basically a secure and ample supply of chemical reagent from a New Brunswick company that's shipping PHAC supplies every week for that. And we have obviously already received millions of swabs. So I'm wondering if it's no longer a question of the supplies to do the testing, what exactly is holding Canada back from having a broader testing regime?
So I think testing, as Dr. New and I have always said, it has to be sort of the right people at the right time in the right place. You don't sort of test. If you test in an area that actually doesn't have much activity, you're going to get issues of false positives, etc. So I think from a sort of guidance perspective, we provide a consensus approach with provinces and territories, and then they have to implement it in their own context. So I think we have a capacity goal. I mean, you want to sort of have surge capacity too, not just the amount of testing that you need right now. In a jurisdiction that actually has the epidemic under control, you may not be testing as much because you don't actually have cases. And we've heard from provinces that now that there's no respiratory virus sort of season, they're actually getting very few people coming in for testing. But all jurisdictions are expanding the testing of symptomatic people, whether they are, have fairly mild symptoms, as well as, ongoing testing of people with more severe symptoms. And they are widening their testing for certain high-risk populations, including, of course, long-term care. Those are the priorities. So each, based on the epidemiology, is testing according to their needs. But all are escalating the number of tests that they can do. So I think some of it is epidemiology, some of it is dependent on their operational requirements, because lab testing has to inform certain actions, whether they be individual or they be population health based. So I think that's the general principle. And we are still ongoingly updating those guidance to see what other testing approaches is appropriate. And that's just on the PCR. Of course, as you all know, the testing strategy for serologic testing is being looked at more broadly under the immunity task force as well.
Thank you. And follow-up?
Yeah, I'm sort of confused. So you've said before we want to get to 60,000 tests per day. I guess we're at an average of 26,000 or 25,000 now. What is preventing us from getting to that? What are the obstacles specifically that we need to overcome to get to that threshold that you've said is the target?
So that is the capacity target. So we do have that capacity in the public health system. So your question is, why aren't we just testing everybody, into full capacity of our system? Well, some of it is dependent on the disease activity itself as well. But testing remains a very key aspect of the next phase, because we want to tread carefully. And if there's any inkling of cases or clusters, provinces will be homing in on those really, really fast so that we don't get any further escalations after we've calmed down the first wave. So that is going to be of primary interest. So they will be looking at the on-the-ground testing in order to do that. But they will have the capacity to search. And so that's what we're aiming for. So 60,000 is the public health laboratory capacity. What they will test will vary from day to day or week to week, depending on what that activity might look like as well.
Operator, next question on the line.
Thank you. Merci. Our next question, notre prochaine question is from Hélène Bivetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour.
Question.
Oui, bonjour.
Yes.
I'd like to follow up
Hello?
on my colleague's question. I'm not sure I understand. So you asked for 60,000 tests a day. So do we have that lab capacity, or do we not? And if we do have that capacity, are you saying that we should be testing 60,000 people a day? And if we don't, why not?
So that's about the capacity of our public health labs. It's not because I asked for it. It is based on the Canadian Public Health Laboratory network of all the provincial and federal labs, that this is a very good goal to aim for, and they have the ability to do so. And so every day, of course, we're still managing swabs and reagents. You never say never if, one day you wake up and some other swab didn't work. So there's a, fundamental dynamic that happens every single day. So there is no magic number between the 25,000 and the 60,000. You got to test the right people, right place at the right time. So I think that is actually a really important concept for people to grasp. Some of the recovery or reopening activities, provinces know that they have to have the ability to detect any upsurge or any clusters or unlinked cases in their communities when they're opening very cautiously. So it's the capacity to be able to do that. That is one of the criteria of the guidance that we've provided and we're building on as well. So so there's, so I think one of the key concepts is that the reopening and recovery strategies are not tied to some magic laboratory testing number a day. And many provinces have actually increased quite substantially their testing as well. Quebec being actually a very good example of lab tests per day that is continuing to go up as we speak. Of course, they have a very different requirement. They have quite a bit of activity in some areas of the province, so they'll be testing that accordingly.
C'est Dr. New, peut-être je peux ajouter quelque chose en français.
This is Dr. New. Perhaps I could add some comments in French too. Of course, we are continuing to work closely with our provincial and territorial counterparts. And we are currently reviewing the guidelines for tracing and testing. It's not about trying to reach a certain target for testing every day. It's just about ensuring that within the population, those who may be contaminated with COVID-19 and have symptoms, of course, that remains our priority for testing and tracing. And under certain circumstances, for example, in a long-term healthcare establishment, then we may do more tracing, contact tracing. These are situations that are more specific, of course, but it makes no sense right now to test everyone in a random way throughout the entire population. It may be a bit confusing because, yes, we are developing serological tests, and that's a different type of test as compared to a molecular test. Serology tests will provide us with different data. And in that case, yes, perhaps we could perform random testing to try and determine what the prevalence of persons infected within the population is. And that will provide us with further evidence and allow us to perhaps adjust our public health measures. But I'm not saying it's not the same level of testing that's required across the entire country. In Montreal, perhaps we need more testing of the population if many people are in contact or are sick as compared to other regions in Quebec. It's not something we should be doing in exactly the same way in each province and region of the country. Thank you.
Yes, as a follow-up, so I was under the impression following your daily press conference that we had to increase testing capacity, and the subtext I thought was we don't test enough. So from what you just said, I have the impression that you're saying we're testing just the right amount of numbers. So am I right? Are we testing enough right now?
So we are increasing the capacity, and that is continuing as we speak. And that's just the public health capacity. It doesn't include other, point of care testing, etc. So going into the next phase, you'll see different provinces are in slightly different time points right now. They will have enough tests in order to detect any kind of upsurge or circulation of the virus in their population. So that is the ultimate goal. And some of those criteria are sort of laid down. But it is, from our sort of collective perspective, it is important to increase the amount of testing. And it depends on where you are in your epidemic curve as to what your priorities are. So I think collectively, provinces and territories, us, all think we should up our number of tests, but it has to be, again, done for the right reason, not just for the sake of increasing the numbers. If the disease activity really dies down, you may have less people that you would test per day. But you can test up to 60,000. That's the key point.
Thank you. We'll now come to the room for a question.
Kevin Gallagher, CTV News. Dr. Tam, many people with cottages and cabins are being told not to visit those secondary properties. There seems to be a lot of different reasons being given as to why those restrictions are in place. And there are many people wondering, what is the public health logic behind that? And is this something that we would see throughout the summer if these restrictions should stay in place for people with second, cottages and stuff like that during the summer?
So I think part of it is that there will be some variations between provinces and territories. But the fundamental principle, I think, being that if you ventured into an area that has low capacity, for example, more remote, more rural, where the access is an issue, and you may impact the local community, that's, I think, the highest concern of public health authorities. So those situations might actually be quite different throughout the country. So I think that's one of the key points. What is important is that you're seeing province and territory recognizing that people need to get outside. And that one of the first phase of easing off public health measures is to ensure that the people who haven't been asked specifically to stay indoors, like you've actually a case or you're contacts of cases, that people can go out and still maintain some physical distancing and the hygienic measures. So for the sake of mental health, physical health, that is actually important. So that you will see them gradually implementing all those measures. But as to very specific cottage to, town linkages, I can't sort of say that. That's a very granular operational element.
And do you have a breakdown of the percentage of deaths linked to long-term care facilities, like as of today? Do you have those numbers?
So as the deaths, overall about 80%. So that's a lot of the deaths are linked to long-term care facilities. But they do, of course, vary depending on, some provinces have actually not had any deaths from long-term care, but it's influenced a lot by the bigger provinces in terms of the national average. But it's going to be a range in different areas.
Thank you. Next question in the room.
81%, sorry.
81. Thank you.
Yes.
Thank you. Hi, Dr. Tam. This might be nothing, but I'm curious because you keep mentioning this inflammatory response that some people with COVID have. Is that the major difference between the mild and major cases, that some people are getting this inflammatory response and other people are not?
I don't think that's necessarily the case. I think as we said that the majority of deaths tragically are linked to the older population and long-term care facilities. So some of that might be related to age and underlying medical conditions. But I think it's definitely been observed that certain individuals, even when they're younger, like under the age of 50, why do they get suddenly severely sick? And for sure, some of them are related to this very hyped up immune response and sort of multi-system inflammatory response. And that has been observed. And it's the subject of the sort of clinical, in the clinical area internationally as areas of study and research.
So we don't know at this point what causes them to have this increased inflammatory response. We're still looking into that.
By we, I mean, I think the international clinical researchers are definitely looking into it. And it's not unusual necessarily or specific to COVID-19. There are many infectious diseases for which it's not necessary even the virus or the bacteria itself, but your body's immune response to it. And I think here we're in COVID-19, as we learn more, we are detecting that this is also a phenomenon seen with this virus. As to whether there's anything that's different about COVID-19's inflammatory response and other virus, I don't think that's actually been studied enough yet.
Thank you. Operator, we'll now go back to the line for the next question.
Thank you. Merci. Our next question, notre prochaine question est de l'inaudible avec la presse canadienne. Please go ahead. À vous la parole.
Yes, hello. Dr. Tim, I had two technical questions. The scientific evidence about when you say older people are more vulnerable, where do you put the target? Because we're getting the impression that the target is moving. It used to be 70 years old at the beginning, then it moved to 60. So what does the scientific evidence say? Where should that target be? And could you also tell me what is now the rate of infection? Last week you were saying that you were hoping that one person would infect a little less than one, and right now it's 1, comma something, and you never said what the something was, 1, quelque chose. So could you give me an exact number of right now, what is the situation? One person is infecting exactly how many?
Okay, so when you say a target, there is no actual target. So you have to look at each age group and the outcome in each age group. I think there is no doubt that there is an age gradient in who gets severely sick. And and it's actually quite obvious that anyone over, every age group, there's a gradual increase. There's an increase in the amount of people that's hospitalized and ends up in the ICU or deaths. And so there is no sort of magic cutoff for any of those numbers. I mean, any life loss or severe illness is important. So it depends on what kind of decisions you're trying to make. There's also an individualized decision as well. And whether someone has underlying medical conditions. So if you're sort of thinking about should someone of a certain age go back to work, there's a very specific individual context to that as well. Now on our website, you will see the age breakdown of those hospitalized, those admitted to ICU. And based on, I can't read out everything, but about, 35% of hospitalizations occur in the 80 plus, 41% in the 70 to 79, 24% in the 60 to 69. Every age group can potentially have severe outcomes. So I think, so I'm not sure if I am answering your question.
Yeah, well, as much as you can. And my other question, the one person infecting how many? Do you have that data?
So I think, again, at the national level is not as useful. I think this is a matter of we have many individualized outbreaks or regional outbreaks going on in Canada. And there are some jurisdictions, clearly there is no community transmission. And others where there's some level of transmission. The last time we checked, it was always sort of hovering around the 1, and that can change depending on what happens to the epidemiology. Like if you suddenly get certain larger clusters or outbreaks, that would maybe tip that sort of above 1, and it'll come back down again. So it's somewhat a fluid number, but I know that we're around that effective reproduction number of around 1. Some days it can go under, some days it may, hover earlier, but it really is an individual localized phenomena. So that's the more important point, I think.
Thank you. Operator, next question on the line.
Thank you. Merci. Our next question, notre prochaine question is from Teresa Wright with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. Thank you very much for taking our questions. Dr. Tam, examinations of what happened in the SARS outbreak made it very clear that nurses who were cobbling together employment in multiple hospitals were a big problem in that case. Why didn't that understanding extend to cover people like personal support workers working in long-term care in this instance?
So I think all the certainly the long-term care situation is the extremely serious and characterizes our key epidemiology at the moment in Canada. And it is recognized that movement between long-term care facilities potentially increases the risk of spread. So many jurisdictions now have tried to put in measures to sort of restrict that movement as much as possible. And so that, different provinces have actually put in their own specific policies on that. And it's not easy to do sometimes because you actually have to provide support for the personal support workers, including their wages. And you've seen provinces now trying to even level the playing field in terms of the what we pay people who are working really hard in somewhat low-paying jobs who have to frequently do more than one job. So that's a very difficult societal situation that we found ourselves in. But I know that provinces are very seized with this issue, and they're trying very much to reduce any sort of inter-facility or inter-setting movement of staff.
Thank you. And your follow-up, Teresa?
Yes, thank you. I'm wondering if you're measuring the number of long-term care workers who are getting sick, as well as other essential workers, to get a sense of who are the most vulnerable people, other populations, in terms of getting the virus beyond the fact, that we know that the biggest majority are seniors in long-term care centers. And if you have those numbers, please share them.
Yes, so the provinces and territories have reported some of the cases related to healthcare workers. So, but what I can say is that, of the there's a number of health workers who have died as a result of COVID-19. And many of them, I'm trying to see if I can have the information. I don't always have everything in front of me, unfortunately. Were people who are working who clean your environment, so cleaners. Some of them were personal support workers. So we have to be able to protect everyone who works in those facilities. We may obviously think of top of mind in terms of protecting nurses, of course, physicians and others, but there are many people who work in those facilities. And unfortunately, some of the deaths that have occurred so far have been in many of the people who provide supportive work in those environments.
Thank you, operator. Next question on the line.
Thank you. Merci. Our next question, notre prochaine question is from Jocelyn Laflamme with Radio Canada. Please go ahead. À vous la parole. Ms. Laflamme, your line is now open. Please unmute your line. Veuillez enlever le mode sourdine.
Oui, je m'excuse, j'avais toujours la sourdine.
I apologize.
Merci.
My microphone was on mute. Thank you. The chief scientist for Canada said, considering that we are a federation, do you think it's possible to follow her recommendations? And if not, what would be the recommendation at this time?
Merci, c'est Dr. Newt. Peut-être je n'ai pas bien compris votre question. Oui, c'est sûr. On est sur un système de gouvernement fédéral avec
do have a federal system, of course, with
pour la livraison des soins de santé, aussi santé publique,
responsibility for delivering public health along with provinces and territories. But in my opinion, we are working quite well, at least at the technical level, with all of the public health authorities across provinces and territories, Dr. Tam and myself. Of course, there are special advisory groups that were formed to discuss and share information and concerns, as well as develop guidelines. Now, of course, ultimately, it's up to each province and territory to implement the policies and the operational aspects, so to speak, according to the way they each administer their public health. So it depends on the context of each province and territory. However, in my opinion, things are going well so far, and we continue to work closely with good collaboration. Follow-up question. I think the main question was about tracing. Earlier, Dr. Tam, you didn't quite answer my colleague's question as to the number that would be desirable. Are we doing enough of it? You said that it depended where we were on the curve. Some said that we should be doing random testing now that some of the restrictions have been lifted. In your opinion, can you give us a sense of when we should be doing more this random testing to see whether or not there are little outbreaks happening that went under the radar here and there? Answer. This is Dr. New answering you. That's a complex question, because if we're talking about testing with using laboratory tests, as we say in English, I'm not sure how to say it in French, but you have to test the right people at the right time, people at the right time in the right place. So, I'll give you a few examples of why it's not so simple to just go around randomly testing people. If we're using an approach in which we're testing everyone across the population and there hasn't been much community transmission, then we've got increased risks of having unreliable results and a higher number of false positives, which will lead to other problems for us. For example, wasting resources in chasing down these false positives. The other thing is, it might give us a false sense of security and safety, because even if a person is infected with the virus, it's possible during the incubation period, if you're not testing the people at the right moment, that person might be at the very beginning of the incubation period, in which case we would have a false negative. And perhaps 3, 4, 5, 6 days later, that person then becomes ill and experiences symptoms, then they would be tested again and have positive results. So you have to test people at the right time. It's not so simple as talking about going around testing everyone. This is why, according to scientific evidence, in our context here in Canada, we're looking at what the criteria would be to properly test the population and have the best chance of truly identifying people who are contaminated with the virus. Obviously, if people are symptomatic, and that's another thing, because at the beginning we only thought, well, if someone's coughing or has a fever or is choking, but now there's a plethora. There are a plethora of symptoms. So we keep reviewing and revising our criteria for for those who are symptomatic and therefore eligible for testing. And at the provincial, territorial, and even local levels, clinicians are saying, well, okay, perhaps at the beginning, we'll just test people who are feverish or who may have a problem with their breathing. But now there's another list of symptoms that are less severe, but may make people eligible for such testing. So this is constantly evolving. But the important thing to retain is that it's not just about setting targets and saying we need this number of tests per day. As I said, perhaps in Montreal, where transmission chains might be different, then in which case perhaps we do want to do contact tracing of following confirmed cases. But in another community, in northern Quebec, for example, that doesn't really have any community transmission, it makes no sense to test everyone. If no one is exhibiting symptoms and there's no evidence of any viral activity in that region. Does that answer your question? Is that a good explanation? Question. Yes. But some people are saying that we should be testing just to see if they're going to reopen schools next week, for example. Should we therefore be testing to ensure that there are no new outbreaks? Or do we have to wait to see symptoms? Or to identify a rise in the number of cases? Answer. Yes, that's right. Dr. Tam and I have said that provinces and territories have increased their testing capacity because they are beginning to ease restrictions and lift some of the public health measures. But we need laboratory capacity for that. So in a school, let's say a teacher or a child exhibits symptoms, well, definitely, there would have to be testing deployed rapidly for COVID-19. And of course, in each province and territory, they have a strategy. It's very important. And as we've already said, we must have an oversight system and a testing for the testing system and be able to quickly test people to see if there are new outbreaks taking place anywhere.
Thank you. Operator, last question on the line.
Thank you. Merci. Our last question, notre dernière question, nous vient de Jamie Pashagamskam with APTN. Please go ahead. À vous la parole.
Hi, thank you. My first question is about the rapid tests that were supposed to be sent to remote communities. I'm wondering what's going on there. Are they ready, and have they been sent to communities in the north?
I don't know of the exact distribution, but I do know that just in my last set of interactions, in areas where capacity is really needed, that they have been, they have some of the tests. For example, we're particularly interested in northern Saskatchewan right now, and they have this test called the Gene Expert, which they can do close to where the outbreak is happening, in the sort of La Loche area, for example. And I do know that when Nunavut was investigating, let's just say, someone in their region, that they also had the capacity using the Gene Expert, which is a point of care test, and they also have that capacity. But I can't tell you the exact distribution of every one of these, but I know that the capacity is increasing and that the priority for those kind of technology is to cover areas that would have required quite lengthy transportation to the nearest lab. So I know that's, that capacity is increasing as we speak.
Thank you. Jamie, and your follow-up?
Okay, yeah, thanks. Today you mentioned children and youth mental health program. I'm wondering if there's anything there specifically for Indigenous youth and children, anything culturally appropriate?
That's a very important question, and so I think the Department of Indigenous Services Canada, Dr. Tom Wong, we work very closely with, and they have been involved in some of these supports. So, and of course, Minister Miller and others. So, because I don't have the exact details, I will refer your questions to them. But absolutely, this is extremely important. Anything that we provide should be culturally appropriate, and that is in consultation with the communities. But I do know that some of the available tools or materials have been developed by individual communities as well.
Thank you. That concludes today's teleconference.